Bismillahirrahmanirrahim. We are going to discuss today an important subject in neurological examination, which is examination of floppy infant. Floppy infant, we mean by it infant with hypotonia. The usual chief complaint or presentation of those infants depend on the age. In the early month of the life, the mother will complain that the infant has paucity of movement. يعني بالعربي الحركة مع الطفل تكون الأم كلش قليلة, and she feels that the infant is hypotonic. While when the child is growing more than 1 year or at the time of sitting and standing, the family will complain that there is delay in the growth milestone. So the chief complaint either hypotonia and decrease or paucity of movement, and later on will be the family will complain from delayed growth milestone. Examination of floppy infant. First, remember you should introduce yourself, sterilize your hand, and ask for permission before doing examination. This is important communication skill. Then examination of floppy infant is like examination of any system. We start by inspecting. By inspecting the infant, you are looking for important things. First of them, the posture of the infant. As you know, the floppy infant will be a frog-like position. This infant is normal, but the floppy infant will be just like this, frog-like position, and you will notice that there is paucity of movement. يعني حركة الرجلين والأيدين تكون قليلة كلش عند هذا الطفل. Okay? First thing, the posture. Second, you will notice the level of consciousness and the presence or absence of any dysmorphic feature. Like Down syndrome or Prader-Willi syndrome, you will observe the size of the head, the eyes, protruding of the tongue, because in pediatric we have many syndromes which are associated with hypotonia. So, inspection, level of consciousness, dysmorphic feature, posture of the infant, and the presence or absence of movement. The test we examine the hypotonic infant, we call it 180 flip maneuver. ليش سمونه 180 درجة؟ Then we are going to start with the examination and the infant lying supine position. And at the end of the examination, the infant will be in a prone position. After finishing the inspection, to start with, we will do pull to sit position. راح نسحب الطفل من أدينه for sitting. During this maneuver, you will observe things. First, you will observe head lag. A floppy infant, while you are doing pulling to sit, you will notice the head will lag backward. راس يرجع لخلف. As you know, usual head support stat are at 4 months, but those floppy infant will still, the head will lag. Second, when he will sit, the back will be rounded in a floppy infant. يعني ما يكون ظهره عدل straight مثل الأطفال العاديين. لا, الباك يكون rounded and he cannot sit without support. This is pull to sit. The other thing that you will notice in this examination, while you are pulling the infant, you will feel a traction response in the hand. The normal infant, you will feel تحس يعني ايدينه مثل السبرينج. We call it a traction response. While in a floppy infant, there will be no traction response. This is pull to sit. Second, we will do vertical suspension, or what we call it axillary suspension. Axillary suspension in a floppy infant, due to the poor tone at the shoulder girdle, the infant will slip from your hand. Okay, this is in a floppy infant. But the normal infant, he can support himself. This is vertical suspension or axillary suspension. Then we will do the ventral suspension. The ventral suspension, we do it by putting our hand under the abdomen, holding the infant in a prone position. You will notice 4 things. First, in a floppy infant, the head will sag downward. Second, the back will be rounded. The floppy infant will not be able to maintain his head at the same plane of the back. The head will sag downward, the back will be rounded, and there will be no flexion at the elbow and at the knee joint, making what we call it inverted U shape. This is ventral suspension. After finishing the ventral suspension, we are going to put the infant in a prone position. The advantage of a prone position is you are going to observe, is the infant able to elevate his head and chest from the bed, from the mattress? and also you are going to observe the movement in the hands and in the legs, in the arms and in the legs. This is the advantage. This infant is able to elevate his head and elevate his chest from the mattress. After finishing this test, we are going to do what we call it scarf sign. The scarf sign, we do it by taking the hand around the neck to the opposite shoulder. In a floppy infant, the elbow will cross the midline, while a normal infant, the elbow will not cross the midline. This is scarf sign. It is positive in a floppy infant. اللي يصير عندنا إنه الelbow will cross يعبر midline. This is scarf sign. The other thing in a floppy infant, you are going to examine the tone, just like this, at the shoulder, at the elbow, and at the wrist. And you will compare the two sides, at the shoulder, at the elbow, at the wrist, and you are going to do shaking movement in the hand to see is it hypotonic or not. This infant, as you notice, he is cyanosed. Look at the lips and at the finger. He has central cyanosis and also clubbing of the finger. This is a case of tetralogy of Fallot. This is examination of floppy infant, and as you know, we have two causes of floppiness, either central causes, which are mostly causes in the CNS, or causes, endocrine causes like hypothyroidism, hypoglycemia, brain insult, hypoxic ischemic encephalopathy, kernicterus, torch infection, or causes in the periphery. Peripheral causes, it is the lower motor neuron lesion, starting from the anterior horn cell to the muscle. Either lesion in the anterior horn cell like spinal muscular atrophy, Werding-Hoffmann, polio, or cause in the nerve like polyneuropathy, or cause in the neuromuscular junction like myasthenia gravis, or cause in the muscle like congenital myopathy. This is examination of a floppy infant.